Okay, by show of hands, how many of you have flossed in the last month? How about in the last 24 hours? So, flossing is a critical component of proper dental health that is often overlooked. And I'm here to show you why you should floss at least once every day. Along with doing extensive research on flossing and its benefits, I've also seen firsthand, shadowing at different dental offices, how flossing can impact somebody's health and teeth quality. First, I will explain how bad dental hygiene can impact your health. Second, I will talk about how poor dental health can be bad for your bank account. And third, I will explain how exactly flossing can benefit you. Flossing helps your dental health along with your overall body health and can end up saving you hundreds of dollars. First off, not taking care of your teeth, either by brushing or flossing, can result in numerous ailments. According to a post on sharecare.com from 2020, excessive plaque buildup can result in infections in the teeth and the gums. Now, plaque is a substance that forms on your teeth, the different surfaces on any side, and it contains bacteria that eat leftover sugars and food particles that may have been left on your teeth if you didn't brush or floss. And when this bacteria eats the food, it secretes acids, and those acids are what in turn end up decaying your teeth. So it's not exactly the plaque itself, it's more of the bacteria within the plaque. An infection in your tooth is called an abscess, and it's like a pocket of pus that can form in the tooth or around it, and it's pretty gross. And it can spread to the surrounding tissue and bone, so into your jawbone if it gets serious enough. And it's often accompanied by fever and pain, and the pain can come back to your ears and to your neck if it's bad enough. If it is in the root of your tooth, you will probably have to get a root canal, but they can also be removed by drainage, which is where they lance it. An infection in your gums is called gingivitis, which when it gets more serious leads to periodontitis. And according to an article on mayoclinic.org from 2020, periodontitis is very serious and can result in you losing teeth and also destruction of the jawbone around where the infection took place. I actually have some pictures of periodontitis. So here's kind of, you can see. So the teeth you can see are obviously in pretty bad shape. And if you notice, this line right here is where the gum should be, but the gum has receded around the tooth. So that's why they fall out, because the gum recedes and then there's nothing there to hold the tooth in place. And then, as you can see here in the more graphic, the decay is spreading in to the bone around the tooth because it's gotten so serious. So it's pretty gross, but it also is very bad for your health too, along with just being disgusting. According to oralb.com, infections in the mouth can also increase the inflammatory substances in your blood throughout the rest of your body, which can lead to more common blood clots and slower blood flow, meaning that oxygen can't get to where it needs to be as quick as it should. Aside from the infections that plaque causes, plaque also significantly decays teeth, which brings me to my next point. Improper oral hygiene can break the bank. According to an article on immediadent.com from July 2018, root canals and crown installments are two of the most common procedures done to help fix decayed and damaged teeth. When I shadowed at my dental offices last summer and over winter break, crown replacements were often the most common procedure that I saw. Among patients, I think I saw one at least every week done. It's when they drill off all of the decayed tooth on the visible part of your teeth, just down to a nub, and then they cement a fake prosthetic tooth onto the nub, so it appears real, but there's actually no real tooth really left because it was so decayed. One crown can cost from $800 to $1,700, according to WebMD.com. The other procedure, root canal, occurs when a tooth has been so traumatized from decay that the nerve within the tooth dies. So the root canal, they take these long metal strips down into your tooth that they've drilled out and get all of the decay out. And then they fill the tooth that they drilled with a resin-like substance that hardens. So it feels like your tooth is there, but it's actually dead. So there's no feeling in that tooth anymore once you've had the root canal. And for a normal tooth, like on the front, it can be about $700, and it can be $900 for a molar because those are often bigger and more elaborate. So how can flossing help prevent getting these procedures done? Brushing alone does not do all of the work to clean your teeth. A tooth has 5 sides, and according to Zamoski from a 2020 WebMD article, not flossing leaves 2 of the 5 sides empty when not clean. When I shadowed, more than half of the patient x-rays I saw had severe decay and cavities between the teeth and were not very commonly on any of the other surfaces. Flossing does 40% of the work required to remove plaque from teeth, meaning that brushing only does 60%, and 60% is a failing grade. According to OralB.com, flossing is able to clean out plaque and food particles from in between the teeth, which is where cavities are most common. So, in conclusion, flossing is critical to dental health because it reduces decay and infection, and it allows people to stay healthier overall and save their money.